Hi, how are you? I'm Dr. Jeff Steinberg. It's nice to talk to you again. And again, I'm a neurologist at the Headache and Pain Center in South Florida. And today I'm going to talk to you about anxiety and pain, both acute and chronic pain. And why do they go hand in hand? Why do they coexist? And why is pain so prevalent in this society or in our lives? So especially during these times with COVID and the pandemic, obviously there's a lot of anxiety going on, post-traumatic stress or traumatic stress, and a lot of people are having worse pain, whether it's because of physical inactivity or they have underlying pain. But why is it that someone who has pain cannot be treated unless you deal with their anxiety and stress? And why do people with panic attacks feel as if they're having physical pain? And why does it cause a flare-up of their underlying pain? And what is the definition of pain anyway? What's the definition of anxiety? And those are things I want to address over the next 10-15 minutes so that you have more information, you can learn about yourself and help your doctor to get yourself better, because that's the name of the game. If you can't cure your pain, at least be functional. If you don't know the underlying cause of your anxiety, at least how to cope with it in the day-to-day moment so you can enjoy your life and continue on with your life. So what is pain? A pain is an unpleasant sensation that's either localized, like due to an injury, like if you hurt your pinky riding a bicycle, or it could be diffuse, whether it's a neuropathy or fibromyalgia. And it is always mediated by your nerve fibers. And there's certain type of nerve fibers that deal with pain. And also, the pain then travels from that local area or regional area through the spinal cord and then into the brain, and then the brain interprets it, and then it also goes to the part of the brain that experiences that emotionality. And what is anxiety? Anxiety obviously is a feeling. It's a perception. It's a feeling of apprehension, of fear, of a potential threat. Now, that could be a good or a bad thing. You get anxious before a ball game or before one of these talks, and it can allow you to perform better or allow you to function. So it's a physiological response. How you deal with that anxiety or that moment of fear or apprehension is what determines if it's a positive experience or a negative. When you become overwhelmed, if it's too much, so to speak, that's when you get these anxiety attacks, or it becomes an anxiety disorder. If it's on a day-to-day basis and it perceives over time, then it becomes chronic. If it's a sudden episode, it's a panic attack. For example, a panic attack, you can get heart rate increase, your blood pressure goes up, you can't breathe, you get numb, lightheaded, headaches. It feels as if you're having a heart attack or a stroke. And we call that fight or flight experience. Your adrenaline. Do some people run away? Do some people go into the fight? Are you a warrior mentality or not? And part of that anxiety is also related to society's perception of pain, and your perception. Some people, like if you're from Northern Europe, tend to be more stoic. I can deal with the pain. I'm strong. I'm a warrior. And other people are more expressive and emotional about it, quote unquote, in the Latin community or the Caribbean community. That doesn't mean it's right or wrong. It's how you live and how you perceive that pain. And that's what a doctor has to deal with that patient in the cultural aspect of your pain and the physiological response of your response to it. So if pain is a physiological response, why do we get so emotional about it? Or how does that affect your emotionality? For example, if you put your finger over a stove or accidentally, put a light over your finger, you withdraw immediately. That's physiological. That doesn't even go to the brain. It's your mechanism. So you feel the pain in the finger, you immediately withdraw it. Why? Because it goes through the spinal cord and immediately it's your reflex. So you don't even think about it. That's a physiological response. How you perceive that pain, you go, that hurts, or you cry, or you don't do anything about it. That goes into the brain and it draws your sympathetic response and then your emotionality to that. So, and women are different than men. For example, more women come to physicians because of their medical problems, especially because of the pain, because they tend to express it more or they're more willing to recognize it, where men may keep it internal and feel that's not necessary and it may be a sign of weakness. And then there's social ramifications to this too. Hey, if I'm hurt, I can't work, or people with migraines, people don't see other people with migraines. So they think, well, you're not really hurt, you're just faking it, or it's not that bad. It can't be if you don't have a cast on, or you don't have a collar, you're not walking with a cane. Your pain can't be that bad. So there's that environmental factor to it also. And a very important aspect is how you were raised. Did your parents say, oh, it's okay to be hurt, and go on with it? Or do they say, or do they become very emotional themselves and they pass that on to you? The very important aspect is if you've ever been emotionally, verbally, or physically traumatized as a child, you sort of repress that. And then when you do develop pain for whatever reason, back injury, car accident, fibromyalgia, MS, whatever it is, how you perceive that pain is almost based, not entirely, but the emotional trauma. Your childhood trauma also leads to how you deal with this pain. Even the CDC recognizes that fact and puts that on a pyramid scale, that the childhood trauma is the basis foundation for how you deal with that chronic or acute pain that is on top of that pyramid. So down here is the childhood trauma, your socialization, the medical issues, and then how you deal with it. So it's very, very important to realize that aspect. And people may not know that. Doctors may not recognize it either. So that is something very important that you have to learn. If you get nothing out of this, if you know anybody that has acute or chronic pain, you may want to understand, hey, have they had any emotional traumas or anything of that nature in the past? And so there's 4 factors to this personal response to pain. The physiological, which I just described, and also how you heal with it. The physical pain. So if you are hurt, hey, you know what? If I hurt my hand, I can't use my hand, I got to rest it. If you hurt your lower back, some doctors may say, do stretches, don't do so much physical activity, which can affect your work if you're doing physical labor, or if you're sitting for a long time, you may need to take breaks. There's the emotional factor to it, which we just discussed, and the psychosocial ramifications. What degree, and that the psychosocial aspects of it will affect the degree of your recovery, how much you'll recover, and your quality of life. Now, if you have chronic pain for, let's say, it's multiple sclerosis, a doctor can't cure multiple sclerosis. And if you have neuropathic pain from that, it's very debilitating pain. It takes a while to get healed, and you may not ever recover from that. But I try to get my patients to be functional so they can enjoy their life. So their life is not encompassed by the pain, but their pain, because it's chronic, is part of their life and how they deal with it, whether, for an acute exacerbation and chronically. And so it's not all about medications, it's about education and figuring out and making that person, my patient, a partner in treatment of the chronic pain. Because I myself don't know you. I get to know you. I get to learn about you, and you get to learn about what's going on with your body, and then we get to learn about your psychological profile. I've had people with chronic pain, and as they're getting better, they go, my pain level's the same. It's still a 7 out of 10. It's still severe. It's moderate. But then I ask them, have you been going out with your family more? How are you being? Is that because now you're exercising more? They go, you're right. I've done more socially. I've been more functional, and I've also been less stressed, and my family is less anxious too, because it's not just a disease of the person. It's an illness that affects the entire family. So they go, well, my relationship with my wife or my spouse is better, and my children are less angst because now they have their mother or their father back interacting with their social activities. So you have to be aware of this. And as a treating physician, I've been board certified in pain, or board eligible, I should say. I've done a fellowship in pain. So I know all the medical aspects of it and even the physical aspects to treat it, whether it's nerve blocks, Botox, epidural injections. And if I don't do a certain procedure, I know physicians who can. But not all neurologists are typically trained in the physiological aspect of pain, and we understand the physiology of a lot of illnesses. But not all doctors are either comfortable or skilled with dealing with the psychosocial issues of pain or the emotional aspects of pain. Not all doctors are psychiatrists or psychologists. So we're not comfortable dealing with the behavioral aspect. And people who have emotional trauma, whether it's a childhood or currently, that takes time to delve into and to acknowledge. First, the doctor has to ask that question, and the patient has to be willing to answer it honestly and emotionally. And it hurts. Your emotional trauma as a child may not be recognized by you. So it's going to be hard for a doctor who's just dealing with your pain to say, oh, let me ask you about that. And that takes time in and of itself. And that's why in my practice, I have a psychologist and we have therapies to deal with all aspects, because I'm not going to be able to get rid of your pain until I deal with the emotional and psychosocial components of the pain. And I won't be able to deal with your anxiety unless I can help you with your physiological aspect of your pain. So they go hand in hand and they work back to back. So it is, as therapists love to say, it is a process. So first time, if you get hurt, the first thing I'll try to do is deal with the physiological aspect of your pain, especially if it's acute pain. Maybe that's all you need. Hey, you know what? I need short-term medicine. I need, x-rays to figure it out what it is, or MRIs, and then basically just treat it. If it gets better, we don't have to deal with that component of anxiety. You may bring it up and we can deal with it. But if it doesn't get better, if there's a delayed response from what I typically would expect, then I have to think of other issues. Like a yellow flag. Is there an emotional reason? Is there a financial reason? All these things you have to take into account. It's really important to do that. The way I was taught in my fellowship was think of chronic pain as a three ice cream cone, 3 different flavors. Right? You can, when you first get it, you can tell the different flavors, right? But as the ice cream melts, you begin not to know which flavor is what, and it's a milieu of flavors. Same with chronic pain. You may say, well, this is my physiological pain, this is my stress related to the pain, and this is the social consequences of my pain. But once it's 3, 6 months, 2 years, who knows which is what? Which is causing what? Is the financial aspect of your pain causing your physiological pain to get worse? Is your panic attack making your pain worse? And why does that happen? I mean, I tell my patients a lot, can you tell the difference between your anxiety causing the pain and when can your pain cause your anxiety? A lot of them will say, I didn't know that. No one ever told me that. And that's where knowledge comes in. Education is key. So you have to know that, and the doctor has to be willing to ask you that, because, again, that takes time. But hopefully what we can do, working together with the therapist dealing with this, we can then, little by little get rid of the layers and not necessarily be about medicines. Especially the psychological component and the emotional trauma. When someone gets hurt and they're constantly feeling pain, it's that fight or flight, like I said, that sympathetic response. Your heart rate's up. When your pain gets to a level of 4 out of 10, and we typically use that as a scale, we call it visual analog scale. 0 is no pain, 10 is the worst pain you've ever had. So 4 is like that. 8 is grimacing. So if your pain is 4 or 5 or higher, we now know that your blood pressure will go up, your heart rate will go up. We now call pain the 5th vital sign. So I educate my patients, before you go to another doctor and saying, oh, my blood pressure's up, tell the doctor what your pain level is. And therefore, the pain may be causing your physiological response. Or you may be having a panic attack, or your anxiety may be great for other issues related to the pain. So you have to tell your doctor your anxiety level. So all this has to be done. So when you're hurt, you remember I said the fight or flight, your sympathetic response goes up? But how do you treat that? So I would like you to think fight or flight may be the physiological response, but I want you to say, I'm going to feel fine as your treatment. I'm going to lower your adrenaline. I'm going to lower that high rate, that high blood pressure. I'm going to make it calm down. And that's sort of what we call the parasympathetic. And that's part of my treatment plan, not just the medical component, not just the understanding the physical limitations, but the psychological. And I'm not saying that we're going to treat in that moment what was your childhood trauma. That's for a later date and another part of the treatment. But just to get you calm. How to treat you when you get that acute pain attack that stops you from working, whether it's a migraine, sudden lower back pain, how to control your heart rate, how to control your blood pressure, how to control your mind to be at ease without medication. You may need it, till you learn the process, but that's the whole idea. There's the medical treatment and the non-medical treatment. And that's where education comes in, and finding doctors who are comfortable and going to spend the time with you dealing with your pain. Because whether it's neck pain, lower back pain, surgery is a treatment of last option. Sorry about that. Treatment is of the last option. Surgery is the last option. You don't want surgery unless you need it. And sometimes that is the best treatment option. But, before you get there, you want to have, as I tell my patients, you want to have healthy tissue so the surgeon can go through a healthy tissue and know that there's no other factors, But I also want you to have a healthy soul, a healthy mind, because a lot of this, let's say for fibromyalgia, some doctors don't believe in that because they think it's all psychological. The body doesn't care what we label it. If I label it fibromyalgia, rheumatoid arthritis, your body responds in a certain way to injury, and its job is to heal. Your immune response goes after it. That's what your immune system does. That's healing. But, there's also the component of the psychological issue, and you have to deal with that. So I know this is brief, and chronic pain is a pain, both for the person and the doctor. And chronic, by definition, is long-term. Even acute pain can affect your quality of life, right? You can't work like a migraine. Acute migraine attack can last for hours or can last for 3 days. And that has social ramifications, and it's stressful because, for example, my migraineurs saying, I don't know when my next migraine attack is going to happen, so I hold on to my migraine pills. And that's stressful. Knowing that another hammer is going to hit you and affect you and affect your social life is stressful. So how do you deal with that? And when you have an acute migraine attack or you have an acute pain attack, it hurts. And not only it hurts, it stops you from taking care of your children or doing your work. So it does take time. The more you know, the more you can help yourself. And the more you can help your doctor to help you. Because it is comprehensive and you are part of that treatment plan. So again, I thank you very much. Be well during this time, and remember to be the 3 C's: compassionate, conscientious, and be calm. And that's part of that parasympathetic, compassion and being calm. So thank you very much. This may have been brief, but please, DM me, go to my website. I'm here to help. If you have just general questions, I'd be glad to answer those too. So please, be well, and again, thank you very much. Bye.